All right. Good morning. For those of you who don't know me, my name's Tommings. I'm the principal of ICOM. A very warm welcome to all of you. Thank you for joining us this morning for this 2-hour deep dive into the Neijing. I'm very happy on behalf of ICOM to welcome Dr. David White, who's going to be delivering this seminar. I want to do a quick shout out also to Elio Bazzani for initiating the introduction, which has led to this very nice collaboration. I think, ICOM's academic and clinical intention as a teaching institution to remain as close to the classical texts seems to align very well with the Institute for Neijing Research that David White directs. So I'm really pleased that we've got David White to share his work, wisdom, and insight with us today. So without further ado, David, I'd like to hand over to you. Maybe you can introduce yourself and the work that we're going to run through this morning. So thank you and welcome.
Thank you very much. Really appreciate it. I'm just going to hide all the things around here and hopefully you're not hearing too many of the dings and so somewhat through my microphone. It's all okay. So to very briefly, well, first and foremost, just a bit of, if for some reason, because I am in deepest, darkest Australia, that my internet fails or something like that happens and it all crashes, I will endeavor to record this. In fact, I will make sure I record it tonight or tomorrow, and I'll make sure that everyone gets a copy. So if there's any issues related to that, don't worry, we will make sure that you get the material. And I would like to thank, first of all, ICOM. It was actually, I think Elio kickstarted this after I was doing some teaching over at Miller's Way Project there last year. And we started chatting about, what can we do in regards to a more in-depth program to sort of the clinical inquiry into Neijing acupuncture. And that led me to meet Tom and Josh, and we sort of got talking. And as I will briefly introduce, it's developed into the clinical Neijing program, which we'll be delivering next year, online and in person as well through ICOM. And it's really wonderful that there are institutions like that with that sort of platform, but also with the drive to understand aspects of classical acupuncture and Chinese medicine. I think it's something that when I started teaching at university around 20 odd years ago, there was just not a huge interest in understanding the classics in that way. And it's mainly because, to be honest, the teachers, and including myself 20 years ago, had no idea what they were talking about in the first place. So it was something where I think now in this semi-classical Renaissance period that we're living in, that we can start to, one, have greater access to the texts. We're starting to understand the importance of having the correct source in the material that we're discussing, but also primarily in the material that we are applying to our patients and in our practice. So I think that's a really important aspect of that. This talk today, which will be roughly 2 hours or so, depends on how fast I go. It is a lecture. It's not going to be a Q&A. If there is time for Q&A, maybe, but there's quite a few people. We're anticipating a lot of people, but because of it's going to be distributed and with a recorded part later, I'm sure a lot of people are just enjoying their Sunday instead of listening to me ramble on. So it is going to just be a lecture, and the whole idea of this was to lay down aspects of sort of the clinical characteristics of Neijing style acupuncture, or Ling Shu acupuncture specifically, because I primarily work within the Ling Shu, and we want to look at some of those identifiable characteristics which kind of make the medicine what it is. And so today's not really going to be about specific techniques or anything like that. In fact, it's more about the sort of structured sort of plan of action of how we approach things in the clinic, some key physiological components of that, and key pathological sort of design concepts within the Neijing as well. So I hope it is of interest to people. And also I hope that you don't understand what I'm talking about, so that you can go, oh, nice, I'd like to actually learn a bit more about this. And then you can pay me to do it later. So that would have been nice too. But that's the idea, is that we're going to go through some concepts here. Some of you will be very familiar with those concepts, and some of you won't know anything about them, and that's absolutely fine. the point is to create a bit of a discussion later down the track, and also of what I will be going into in great depth in the program as well. So that's kind of the idea of what we're looking at. If you're unfamiliar with who I am, obviously David White. I sort of my introduction to Chinese medicine came at a very young age. I worked with a wonderful teacher here in Sydney who he was the first European, his name is John Dolick, was the first European to graduate from the Beijing University of Traditional Chinese Medicine, I think in the sort of mid-80s or so. And he was a unique guy. He was my martial arts teacher, so that's primarily what it was. But I started learning about principles, and I started even reading aspects of the Neijing and those sorts of things when I was around 14. And then I sort of fell in love with it and decided this is what I want to do. My work with the Neijing came through a different teacher, Dr. David Tai, but also came through sort of my work and inquiry into the text and into my clinical practice as well. So it's through a certain lineage aspect, but it's also through my own sort of ideas and my inquiry into the text. And I absolutely am still a student of this medicine, and I always will be. And that's the beauty of it, is that it is a lifelong study. And it means that if you have studied with me in the past, there might be aspects which are familiar, but then that I repeat, but they will change. And that's part of that sort of cyclical nature of studying any of the classics, is that you sort of just go through it bit by bit, and you refine it, and you repeat it, and you replicate it, and you go back to, you know, refining, repeating, and replicating. You just keep going through those notions of trying to get an understanding of whether the sort of cryptic passages of these texts, or you're trying to get sort of more and a greater understanding of the culture of the texts and those sorts of things. And without a doubt, if you've studied aspects of the Neijing with myself or with someone else, then, you know, this talk, but also the program, will certainly bring quite a lot of light to your clinical practice too. So we should probably move on with the slide here. My computer's a little bit slow, but there it is. And if you're unfamiliar with the Institute of Neijing Research, briefly, my goal with starting that was to, one, present my material, to develop courses such as what we're looking at, and to teach this material as best I can, because I just found particularly, you know, there's a lot of different avenues to study Neijing material and a lot of different inquiries, but the clinical sort of foundation of that material was really lacking. And that's where my inquiry sort of sits at that clinical level. And then, you know, slowly I go through sort of theoretical, historical. I'm definitely not a sinological individual in any way whatsoever. I don't hardly pronounce that correctly in the first place. But my understanding of language is very, very raw when it comes to Chinese. And it's getting better, but you know, I'm not here to teach the language. There are better people to do that. The goal of the INR also is to bring about sort of a community within sort of studying the culture and medicine of the Huangdi Neijing. And hopefully next year we will actually have some quite exciting new teachers joining us as well, and some other ones returning, such as I believe Tyler Rowe, who is in this talk somewhere floating around, to do some more discussions on their inquiry into the Neijing as well. But above all, it's about that clinical approach. Very briefly, the clinical Neijing program is going to run for approximately 20 months. If you've studied with me, it can go for around 14. And it's going to be a sort of a full approach to many of the concepts we'll talk about today, but going through diagnostics, going through foundational material, going through interventions and needling techniques, both preliminary and advanced, and then about a year's study of what I call the compass of the Jinglo, which is going into understanding the principles and primarily the pathomechanisms associated with each of the channel representations within the Neijing. And we sort of sit within that Ling Shu chapter 9 through 13 area, and we work with that, but we then sort of approach it and look at how it's represented throughout the entire text historically, and then also how it's represented and practiced in clinic. And that's where the focus on the Ling Shu Jing becomes sort of paramount to that, and why I use the Suwen more as an adjunct text in terms of understanding or reinforcing my approach to the Ling Shu Jing. So primarily, yes, I'm a Ling Shu Jing individual, but you can't be a Ling Shu Jing practitioner without studying the Suwen as well. It's just that because of the clinical structure and of the text, in terms of it is a very straightforward sort of manual in approach. That's sort of why I've lingered within the Ling Shu Jing more so. It's the same thing with my teacher, and there's a lot to learn within that. Very briefly with the Ling Shu, with the Neijing as a total. I don't want to make this a historical discussion. There's many easy ways to access that material. But just briefly, in terms of with the Neijing, we always have to ask us, well, what is it exactly that we're reading there? Who are the authors of this text? I want to look at whether the edition of that text matters as well, because unfortunately what happens is that what we're reading today is not the original text. It's text that's been edited, it's been chopped together, that probably has elements missing and so forth. And then, of course, there's the language matter as well as we approach it. I think, and this is why I want to talk about the principle of practice and approach with the Neijing, is that when we're reading it, we are reading the current sort of extant editions of it. And the Ling Shu, I find that from edition to edition, or even, translation to translation, radically different, but addition to what's available to us in Chinese, as long as it doesn't have commentary, they are very similar. And I think in the end, we've got to work with what we have. And what we have to do is try to identify the underlying sort of themes within those texts, that even if it's not the original, although many parts of it would be, we want to look for those identifying themes, and we will see them throughout other adjunct sort of materials of the era. So if we're looking at pre-Han material, if we're reading texts such as the Huainanzi, Guangzi, even looking through the Zhuangzi, these sorts of books, we're going to start to see themes of how their world was approached and how sort of they view their worlds, which is what I often call the Han lens. And we can also call it pre-Han lens if you wanted to, because of those texts, but that sort of approach. So it's the same thing if you look at, for instance, a later text, which is the Jia Jing by Huangdi, that text has tremendous amounts of the Ling Shu, of the Suwen, probably prior to many of the editions that we currently have now, and of the Mingtang and those sorts of books. And you can see that the approach and the principle of practice that is exampled within that book is sort of on par with what we're looking at within the text that we have access to now. So ultimately what we're reading and what we have access to is what we have, so it doesn't matter. And the authorship, that also doesn't really matter, because it was really a collaboration and a mixed match sort of writing of various essays and smaller texts and so forth that were pushed together because they had that similar theme. So edition, therefore, today doesn't really matter as much unless you're talking about the translation. This is where language does matter, because the translations of the Neijing, there are many translations and interpretations, and most of them are terrible. Most people now work through Unschul's Suwen and Ling Shu, and that's what I'd recommend to do, because one, it puts us all on a bit of a level playing field of inquiry, but it is at this stage the most sort of concise academic translation of that text, even though it has its flaws. But any translation will have its flaws. But the other aspect of asking the question of whether language matters goes into whether, ultimately, to be a efficacious clinical practitioner of Neijing medicine, or of any medicine or acupuncture, you don't need to be able to speak or read at all. You just need to be able to observe. You need to be able to get an understanding of how we sort of make those inquiries in clinic for that patient, and, there'd be arguments you don't even need to see for that either. You just need to be able to feel then on top of that, so the language matters only in regards to instruction. initially, but in terms of actually developing your clinical skill, the language matters less. And learning Chinese, for instance, or looking at the etymology of characters and those things, they will always reinforce your understanding and approach to this medicine. But to become, completely proficient in and fluent in classical Chinese, it will improve you as a scholar, and it will improve you as a teacher, and it will improve you those. But as a clinician, it will only take you so far. Clinicians need to have that hands-on clinical experience. So that's why I sort of bring those up in terms of approach, in that what I'm trying to do is, yes, I still teach aspects of the language, and yes, I'll have people who will help me teach aspects of the language. Yes, I still make inquiries through the language, but as I'm trying to teach this theory, we're trying to step a little bit away from the fact that we're going to look just historical aspects of that language and just look at how they are presented clinically and go from there. I hope that sort of makes sense from there. And one of those aspects, and sort of to start the lecture as it's meant to be started, is how, and sort of we're going to ask in a second, what sort of does Neijing acupuncture look like? And, how is it expressed within the clinic and those sorts of things? I've got a bit of a hoarse voice because I had a cold a little while ago. So the first thing I want to say is the idea in the Ling Shu, the underlying concept of approaching our patients, of approaching this text, and of approaching and identifying the characteristics of what Neijing acupuncture is this concept of us guarding and holding onto what is considered the unseen components of basic of pathophysiology. Now, this can stem definitely to more philosophical understandings and so forth within Chinese culture, but within medicine, this idea of being conscious of and the manifest, guarding and holding to the hidden and unseen, which are basically the cornerstone of our clinical efficacy and clinical clarity. So understanding the empty spaces, understanding how to create and where we can infiltrate those empty spaces to create lasting change, and how that will occur. So when we look at Ling Shu chapter 1, it has a very particular hierarchical sort of introduction to the physicians, where it says sort of the course, guard the xing, the form, and the superior guard the shen, or su shou xing, shang shou shen. Excuse my pronunciation, right? And it goes on to talk about guarding this idea of sort of trigger and mechanism, which is guan and qi. So same sort of concept. And so within these two things, we have this idea that there's an element of inferiority in being a physician that is only looking at the sort of most superficial or immediately apparent concepts or presentations in our clinical practice. And then as we sort of go deeper, we realize that within this idea is that there is an unseen element to what we should be actually trying to be conscious of and what we should be trying to engage. With the first one being the Shen, which I'm sure most of you are familiar with, which I often talk about in regards to illumination, the Shen being something that brings light to or makes something else apparent. And therefore it is, the illumination of things, but it's also how we receive and perceive information and relay that information. And that being one of the absolute cornerstones of medicine is that communication and relaying of a message. And that ultimately we're trying to relay our message between the pathological diseased region and the rest of the body to engage the Shen in order to facilitate some sort of element of change within that body. And we do that through a messenger, which is our tools, which are our Jiuzhen, our 9 needles. And so we try to make sure we get precision in communicating with that concept of the unseen, of Shen, in order to treat also what is manifest, but also to understand the container of the Shen, which is that hidden manifest component. So part of that is that as we approach that, and our technique becomes absolutely paramount to how we sort of can subtly and quietly and gently sort of approach this concept of Shen to talk to the body to create that change, we also have this idea of Qi, or mechanism, or dynamic. It's translated a lot of it. The trigger of the mechanism, it can also be discussed. Qi as an idea is really about precision and timing. It originally came from sort of 6th century design and discussions on the mechanism of a crossbow. And I'm sure many of you have come across this idea as well. But the idea was about precision and timing. And that is the underlying key to properly engaging and communicating with the patient's Shen. So it's that sort of an initial concept of something that is very subtle, something that is small or slight in movement, that through some interaction and exchange, that it can have a far-reaching, and in relation to the crossbow, it was a far-reaching, dangerous sort of consequence that would manifest. In regards to medicine, it is also the fact that that one small, subtle change that can occur within tissues, within channels, within an organ, can also have far-reaching, dangerous consequences. But then on the flip side of that, it's also that subtle needling technique that we're going to be trying to get an understanding of, the subtle changes on the pulse that we're trying to get comprehension of, that subtle sort of approach of our complete sort of examination and diagnostic criteria, if you will, that approach through there, that also has far-reaching consequences, but without the danger. The idea is actually, on the flip side, it is not dangerous, but it's actually going to facilitate a positive change. So that's kind of where that is. And that positive change happens within that empty and unseen space, Kong. Okay? And that empty, unseen space is where we work as clinicians. And hence why the superior works with the Shen and Qi, and the inferior, works with the Xing and Guan, or with the what is readily apparent. I don't think it doesn't mean you're inferior if you also work with the Xing, as long as you recognize the Shen, or it doesn't, or the Qi, but you have to understand the trigger. I mean, if we're talking about the trigger mechanism of a crossbow, then there is the actual finger touching that trigger that has to initiate that change. But then there's an understanding of the underlying mechanism of that. And, that subtle yet dangerous component of the G is why we need to guard, and why we need to cultivate that understanding of something that we initially, even though we have initial touch, we do not have initial sight of what we are working with. So in essence, the concept of Qi and the concept of Shen is that we have a very cautious clinical approach to this unseen, in order to avoid further damage and disaster inside the body. And it's an action-efficient sort of strategy in our clinical approach. And when you talk about action-efficient mechanisms or action-efficient ideas, then we also can harp back to the wonderful concepts of, Wu Wei and those sorts of ideas from the Tao Te Ching as well, which I'm not going to discuss here because it's a big subject and we're just talking about little things. But that concept and those sort of parallels can be made between those ideas. So that's the thing. So when I say to act as a physician, it's not about being anything in regards to our ethics and morality, although Qi does have connections to that, but it's more about our cautious approach to what we cannot readily see and what is not readily apparent. And so that's kind of how we're going to sort of define what is Neijing acupuncture and what does it actually look like when we're dealing with Neijing acupuncture in the clinic. To have the label Neijing acupuncture is really to make this practice style defined. And so that's why I use the term Neijing acupuncture or Ling Shu acupuncture. It's just so people know what we're working at. What source are we working at to do that? And people use it with other things, with made-up ones. I'll bite my tongue. But with that made-up ones, or Tung acupuncture or Toyohari acupuncture or things like that. They're not made up. I'm not saying those ones. But within that concept, they do it because it's style defined. But in terms of the Neijing, in terms of any of the classical things, it's a style defined by the structured principles laid out within those current extant texts. And that's a really important aspect. It takes that, but when we talk about Neijing, we also adopt all those accompanying ideologies that manifested around it. And that's kind of this hermeneutical approach that we take to the text, where we try to gain insight. And again, I bring up that concept of the Han lens. We try to gain insight into the authors. Again, the names don't matter, but the period in which they wrote it does. To gain insight into how they approached life, how they approached not only daily life, but also the cosmos, how they approached every natural sort of occurring thing around them, and then how they applied that to the body. So those things are really important to that. And there's so many ways that we can look at those in terms of understanding, like I said, cosmological manifestations, but also patterning from the cosmos into the body, or patterning within disease, or as we're going to look at as well, what we see naturally occurring on the outside is manifest on the inside as well, as I'll demonstrate in a second. One thing that is worth saying when we say what is Neijing acupuncture is that from one person to another, Neijing acupuncture can look radically different. And I say this, I mean, there are not a lot of people out there teaching Neijing acupuncture. I mean, essentially, there's two schools out there, myself and there's Ed Neal. He runs the Apricot Grove. And his approach to it is probably a little bit more different and unique to my approach to it in terms of the theoretical sort of structure. And my approach will be different and unique in regards to maybe the clinical structure. And the aspect of studying such a complex, and like I've used the term before, kind of cryptic text in terms of structure of the Neijing itself, of those 162 chapters that we work with now, it means that the clinical experience and the living clinical experience of the way that it is approached, the varying characteristics of the clinical expression of Neijing acupuncture, and that will alter greatly depending on lineage, depending on teacher, depending on geographical representation. A good example of that is that I'm in the Southern Hemisphere, and I have to, in order to understand something like Wu Yun Lu Qi, for me, I have to call Tyler Rowe, and I go, Tyler, I don't know what I'm doing, help me, and he helps me. And but if you're in the Northern Hemisphere, it's more easily readily apparent to be able to apply the theory of Wu Yun Lu Qi to the Northern Hemisphere, because that's where it originated in. So aspects like that do change how we practice, do change how our inquiry, and do ultimately change our intervention and clinical outcomes as well. And it doesn't mean that one's better than the other. It just means it's different. But as long as it does have, again, as I'll demonstrate today, the clinical structure and principles of practice there, then all is well. And that's kind of where we're sort of heading to with our approach to the Neijing. So one thing that I would like to discuss here is the compass of the Jing Law. And the compass of the Jing Law is a term that I have given the study of the entire channel system within the Neijing, and particularly Neijing Ling Shu. So it is the study of all aspects of the channel and vessel representation in the Neijing. One aspect of the idea of the compass is that I sort of focused on those key chapters of the Ling Shu that I mentioned before, which is Ling Shu chapter 9, Zongshi and the ends of beginnings, 10, Jing Mai, 11, I've got to make sure I remember them in order, Jing Bie, Jing Shui, and Jing Jin. Those sort of 5 chapters that we work within that, where not only do we have discussion of pathway, or not only do we have discussion of circulatory movements within that, but we have key diagnostic discussions of how to assess those pathways, primarily Renyin Chen-Ko pulse diagnosis being absolutely key to those pathways, observational diagnosis, being key for our Lo Mai, Lo Bie, and of course, our Jingjin or tendon pathways. And then also we have the idea of representation of those pathways in nature, or and vice versa. And beyond all of that, and this is where my sort of focus is the pathomechanisms and or pathological representations and disease mechanisms within those pathways. So that's a big aspect of how I am approaching this concept of the compass of the Jinglong. The core of the compass is what I term the channel complex. And a channel complex is a series of conduit-based movements woven together through mutual dependency and correspondence. And that is one aspect of how I approach each individual entity within the entire channel system, is to study this idea of a complex. So some of you have already done some of those studies with me. For instance, I might call something, Western metal. And then that will be the study of the facial tie-in as in lung channel, but it would also be a study of the separations from that channel, being the lo bie, le tue, and lo mai within that. And going into, skin divisions, disease representations, needling techniques, point study, and so forth and so on. And so that's what I call the channel complex. So it's that mutual dependency correspondence within that, and then how and why we sort of work on it. But within Western metal, obviously, we study the yin, we study the yang as well, which would be the dachang, large intestine channel as well. And as we sort of approach it, as I say here, the compass is the compilation of the complexes. They all sort of come together as an understanding. So ideally, if this wants to work, our conduit movements within that are our channel and vessels and what we talk about waterways, because the study of how water moves and things, as you saw, we're going to look at some of those things that move along longitudinal and latitudinal planes or pattern pathways. The longitudinal pattern pathways are anything related to our Jing, and our latitudinal pattern pathways are anything related to our Lo, creating that sort of cross-section. It's like a graticule in cartography, where we look at the different lines that sort of create the planes within that, okay, sort of topography of that as well. And that also even goes into an understanding, as we'll see soon, of the depth of these pathways, what we call like the bathymetric study of these pathways, where we're looking at the floor and the depth and how they understand and the correlation between what's happening at the very depths of these circulatory movements all the way up to the top. So we have here, for instance, a good example, and every time someone teaches these sort of Neijing material, we like to put pretty examples of rivers and streams and those sorts of things in order to engage someone. And they go, "Oh, isn't it lovely? We work in these sorts of things." And I'll soon show you why that's not the case. But in a nice, healthy sort of structure like this, where we have the movement of the water, the bedrock of the river, the corridor of the river, the nourishment of the environment around that river, this is our channel. This is a channel complex that we're looking at through here. This would be also where we're looking just at one sort of, as an example, Jing pathway, where we have that sort of element of nourishment to all levels. And if we took that and replaced it with a cross-section of the flesh, we would have it from the hair and the skin structures to the muscles, to the vessels, to the tendons, to the bone, and so forth, and not necessarily in that order. But that's what we're looking at. The relationship, though, between the substance that moves through that conduit, through that vessel, and the structures around it is what is most important to our understanding of pathological change. And that is how that area around that breathes through that region, through there. The contraction, expansion around the moving substance is very important. It's like when you study rivers and things, they talk about riparian land. And that riparian land is the habitat that is created around it, is the structure and support system that feeds and moves with the substance that is inside it. As an example here, looking at that river corridor here and the relationship between that land, even at the absolute far reaches, of what kind of seams away from the water structures through there. Okay. But of course, this is kind of where we are starting to look at what we deal with. And this is the Ganges here, but you can see primary conduit movements and what we can consider longitudinal movements and their latitudinal counterparts circulating that material throughout the area, coming from a larger circulatory source, being our seas, being our Zhang and Fu and so forth, okay, and feeding into that and vice versa. So that's kind of where we're working within Neijing material. And when we're looking at those initial chapters, and the goal of that is to say, yes, we're sort of, as we are sort of studying, yeah, we're walking along this river, we're moving down with it, and we're interacting with it. But again, going back to those principles of the unseen, we are not just looking at what is on the surface and what is immediately apparent. We're trying to get an understanding of the ecological system that lies beneath this water, that interacts with the soil, you know, and we're going to be dealing with, if I jump ahead a little bit here, we're dealing with this. We're dealing with diseased rivers. We're dealing with diseased pathways, ones which have, you know, a lack of nourishment to it, ones which have, you know, artificial crap built on it and artificial things that break and block and create obstruction to it, causing disease, things that flood, things that move in an obscure manner, which is in an unnatural manner compared to the environment around us. Okay, so that's where we sort of linger. And even though it's nice to think that we sort of are floating on this pretty boat down a nice river, we're not. We're dealing with disease. And that's where the composite disease design sort of starts to manifest. The Neijing or Neijing medicine sort of, it focuses, you know, on the impact of environmental characteristics on the bodily form. So the idea of this is that the expression, the terminology used within the disease design when we're talking about channels is very simple, actually, because a lot of it is just based on whether something exists or whether something is lacking or is not there in the first place, or whether something is causing a contraction on the area or whether something is causing chaotic expansion in the area. And again, we'll look at some examples of that later. So we're going to, I mean, the terminology that I have here, the ideas that I've sort of put up here, they are just the general sort of terminology used, particularly within, for instance, those first 3 points there, they're used within Lingshu chapter 10, the Jingmai. And we're talking about what happens when there is an excited aspect of or chaotic movement within the pulsating regions of the vessel. What happens within what we call the generated diseases, which talk about aspects of channel organ correspondence, and what happens when there is just pure abundance and depletion within that as well. And how do we approach that? How do we diagnose that? And therefore, how do we treat it? What diseases does an abundancy within a particular channel manifest as? And within that, you know, what does the Neijing sort of mean when it talks about cough, or it talks about, you know, Zangmen, when it talks about fullness, you know, lingering within the center, or it says there's a B-based sort of contraction occurring within a certain tissue layer. What does it mean by that, and how do we approach that? And that is also applied, for instance, to the Lo Bie or the Lo Mai, also Lingshu chapter 10, Jingmai, which is the latter part of that chapter, which talks about that latitudinal movement. What happens when the pathology that we're trying to deal with starts to go into sort of the side alleys and streets that we often encounter? What happens when it gets lodged in unique vessel regions that are difficult for blood and qi to circulate in? What happens when there is an abundance in that? And what happens when there's a depletion? And again, how do we diagnose it, and how do we treat it? So that's sort of idea, but ultimately the underlying core understanding of the pathology is very simple in regards to excess, deficiency, or abundancy, and lacking, whatever you want to call it, or depletion, and then correspondence within that, within tissue layers, within organ correspondence as well, and channel to channel correspondence. Similar to when we talk about the Jingjin, and the Jingjin being our tendon pathways, you know, what happens when there is an obstruction or contortion or some sort of external environmental pathology that is impacting these tissues, and how do we address it? And this is sort of that disease design. It's very straightforward. I mean, for the Jing, for instance, very straightforward in terms of how to diagnose it. It says, look at the patient, understand that mobility and motility of that patient, understand the surrounding structures of that patient. And there's a lot of modern inquiries into sort of the anatomy of these classical pathways as well, which I think is fantastic. But then primarily understand what is happening from a three-dimensional perspective to the tissues related to what Jin is, which is going to be our tendons, sinews, ligaments, connective tissue, the membrane of that connective tissue, and so forth, Jin Mo, all those sorts of concepts. And then how do we infiltrate it? And again, the approach to infiltration for Jin is relatively simple, but sometimes very hard to identify when to use what. And it may be something like we might be using our needle like a knife. We might be heating that needle and plunging it into a certain level. We might be needling to create space around a tendon and bone, those sorts of things. And not to plug myself too much, but I've got an article coming out on exactly Jin and the needling techniques related to that for the JCM very shortly. And then also we will look at things like study of the Jingbian. Now, the divergent pathways or separations of the Jing do not necessarily have diseases of their own, but they do give us a greater understanding and reinforcement of circulatory movement. So there's a little bit of controversy sometimes with those pathways, with the Zhen pathways there. But the Jing Shui, which is like I mentioned before, which is the water, the rivers of that, which is really part of the Neijing's and the Lingshu way of showing us this correspondence between what is naturally so in the environment around us and what is occurring within us as well. And that is that if you look at a river and if you look at these things around us, that is what you're dealing with inside the body. If you look and start to approach the Neijing from Lingshu chapter 1 all the way to 13, and that's where you can stay for many, many years when you're studying this text, it just gets deeper and deeper into disease study after that. But if you stay within those first 13 chapters, you will see that they are trying to express and they're trying to tell you, well, you know, it's like often Chibo says, well, you know, these things like these, I'm not saying just Chibo, whoever says, sometimes it's Huangdi, you know, these things that you see, you know, outside in the river, you know, the way that we structured our streets or the agriculture that we use to, you know, grow our stock of grain and feed and all those things, these structures, you see the hierarchy that we have in our government, you see these things. Well, guess what? They happen to also exist within our bodily form. And when it says that, it makes it quite, you know, approachable. And then all of a sudden, as you start to read those adjunct or accompanying text, you start to go, oh, well, now I can see the body within these texts as well and how they approach that too. So that sort of socio-political overlay that we often have within the Neijing is actually quite an important way of just sort of getting an understanding and appreciation of their worldview. Right. Hopefully that sort of makes sense. I'm starting to waffle. So again, diseased, this is where we're working. This is what we're trying to do. This is what we're trying to impact within the Neijing. This is where we're trying to linger. And what our goal is to do is to bring nourishment to this area. And what our goal is to do is to, you know, remove obstructions and so forth. And very uniquely within acupuncture, what we're trying to do is to do that without introducing anything permanent within the body, if that makes sense. I mean, it might be heat, that's understandable, but we're not doing it through herbal medications, which is going to come through here and blast that out of the way, you know, a Cheng Chi Tang sort of formula, and it's going to move things and it's going to create some sort of very definable changes then and there for the patient. With acupuncture, we come in, we're trying to create a harmonious relationship between the environment of the diseased area and the environment of the healthy area within that body. A good example is, say, we're working on a scar. A scar itself is diseased pathological tissue, and particularly it can be very seriously diseased pathological tissue, say through an obstruction of blood, or the influence of cold within that, and the tissues and the contraction that can happen around that. So now what we're dealing with, the scar doesn't matter, we're dealing with cold. And that cold itself, as a pathological environmental factor within the body, is impacting that particular area and slowly creating change because of the change in the twist that's occurring within the tissues, the impact on the circulatory system underneath that, and all the way down through, the 5 tissue levels, it can create change through there. And of course, as we know, that subtle change can have long-lasting effects elsewhere within the bodily form. So what we're trying to do is create and impact the tissues that are lying around that region to get the healthy, good stuff and extract, because most of the time when you read about the needling techniques, it is about extract what is sort of unseasonal, what is the evil visitor there within those structures. And that's the idea. So when we're dealing with something like what's on the screen here, when we have to bring nourishment to, we have to approach it again like the understanding of waterways, of damming things up, of bringing things to the area, and of telling the body, and telling, that's the idea of engaging the Shen, that this is where the problem lies and we need to create this change. Sometimes we have to do it very subtly through our needling. Sometimes you have to be more aggressive. Sometimes that's why we have in our needling techniques. And if you're unfamiliar with my teachings, I focus a lot on the needling techniques of the Ling Shu. Sometimes we have to go in there and we have to aggressively plunge the needle to the depths, rub the bone in order to engage that Shen. Or, as I said, we have to heat that needle and plunge a hot poker into that person to engage that Shen in a very different way, or inject some fire itself into the area, inject that yang qi right there into that region. And sometimes we have to then very subtly and very quietly, we have to make sure that we do it in the proper understanding of the ebb and flow of the patient's breath. We will subtly needle, or we won't even puncture. We'll just rub and massage a vessel in order to create that change in a very subtle manner. Often when I talk about needling techniques, I do so talking about engaging the Shen like how we would, talk to an animal. And particularly I use cats all the time, because cats have a very reactive nature to their environment around them. And you're not going to run and scream at a cat if you want them to come close. You want to do that if you're dispersing something. Going back to that cold, you want to disperse that cold, go in there hard, run, scream, throw things. I mean, don't throw things at cats, but throw things, do those sorts of things. But if you want that cat to come close to you and you want to do it in a subtle manner, you have to be quiet. You have to entice it with something. You have to subtly, and I mean, our enticing mechanism within Neijing acupuncture is so simple. It's moxa. We're going to warm the area. We're going to bring something to the area. We're going to allow that body to go, oh, it's nice. It's a friendly environment. We can create that change here. And it sounds a bit cheesy, but that's the idea, is that we're just slowly talking to the system when we want to bring something to, and we're yelling at it when we want something to disappear. And that's why another characteristic of defining Neijing acupuncture is that it's not just all aggressive needling, and it's not just all light, subtle needling. It's what exactly that patient needs in that time and place. And that's what we call level-based needling. So even if there is obstructions or flooding or something, our techniques and our methods and our examination criteria, as I'll demonstrate soon, will have to change precisely for what that patient is presenting to us in practice. And that's what we're going to start looking at within this concept of the compass of the Jinglo here. As I sort of work through this, obviously I've got a few things that are going to pop up on the screen soon. The idea is a structured approach, but also this is a simplistic approach and not the defining, ultimate, all-encompassing approach to the Neijing. There are many different models. I'm using this, and as you'll see also for our plan of action, I'm using those as examples of Neijing structure, Neijing material. So within the compass, as an example, we have these different areas that will be infiltrated. And from each one, whether the disease is coming in through the skin, whether there is low or what we could just call superficial entry and exit of a pathology, or whether it's affecting the Jing and associated structured, or whether it's now affecting the Jingmai and deeper passageways, including, like I said, Bier passageways, or including within the tissue structure as well, which we'll talk about soon, or whether it's now lodged deeper within the Zhangfu. And that idea of lodgement is something we'll bring up a bit later. The idea here is that it is, again, that understanding that if there is a level affected within our pathology, then that different level will mean that the component of the channel will be different. It means that the characteristic of the disease will be different. It means our examination criteria will be different, and therefore our intervention and needling technique ultimately will be different. And that is one important thing. And nothing will ever really repeat itself in that way. It will always be different. And within each of these different four primary sort of regions of structures that we work with in the channel system, they will interact with one another back and forth. That means a disease and a manifestation of a disease will shift from one to the other, or can shift from one to the other. But it does lodge there. We're going to talk about this concept that I'm working with called processional pathological metamorphosis within the Neijing a little bit later, of how a disease moves and transforms, and this concept of lodgement. So it can lodge, and it can lodge for years, and it can get stuck within this. It means that the work should ultimately be where this lodgement manifests, but it's not always that simple. And within these as well, each of these ideas are going to have impact through that environmental characteristic on each of these individual forms that exist there. So it's what the 6 Qi manifesting within that. It will manifest in the terrains, in the tissues. Excuse me, I'm going to have a sip of water. Tissues, within the vessels, within the different channel complexes. And as I say here, it's anchored in pathological breath. Pathological breath means that it is anchored within seasonal breath of that manifestation of disease. And we'll talk about seasonal breath shortly, but seasonal breath, but I'll mention it here now anyway. Seasonal breath is when we're addressing the season that disease manifests in or originated in, and the season that person exists in simultaneously. And then also within the five phases as well. And obviously the 5 phases is a huge subject. Most of you will be familiar with 5 phases, but it's the layer of those 5 phases that can be applied to each of this. And that goes back again to tissue structures, because I love the idea of level-based needling and that idea of working within the level of the 5 tissue sort of matrices that we work with. And so that constant exchange between pathological and physiological levels is something we have to be conscious of in order to identify that unseen mechanism that I was talking about before, in order to identify where that change is and to understand whether that far-reaching change is starting to manifest, or where that sort of processional movement is being created. And then intervention is ultimately decided on or before a transition from one area to the other. Not all diseases just start at a superficial entry-exit level, and not all diseases eventually just end up lodged within the Zhangfu. It doesn't work exactly in that manner, but it's a good way to get an understanding. And sometimes an internal lodgement can manifest on the skin, and that skin needs to be addressed in order to communicate with the deeper aspects of that. A good example might be using the ideas of treating the skin in order to impact the corresponding lung. And things like that. We talk about that in our 5 sort of directional techniques of the Guanzhen. So those sort of ideas can be used. So that it's a system where we're constantly moving up and down and to and fro, but it starts to give you an understanding of, in your mind, when a person is presenting in your clinic, okay, where in this compass of the Jinglo are they sort of lingering? And then I start to identify and refine and define those ideas of precisely where that identification is where that disease is manifesting. And so that's what we're going to be looking at as we go through this idea of a structured plan of action. As we go through this is over the next 2 slides, we're going to sort of slowly sort of work our way sort of through this idea. And again, I'm trying to give you just a picture of sort of what is Neijing medicine and what the approach of Neijing acupuncture is. So some of it will seem quite straightforward, and then others won't. So obviously, most things within clinic, they start with our presentation. And it's at the presentation that we're going to start to get that initial understanding of direction of disease, location of disease, and those sorts of things. That makes sense. That's easy. As we go through that and we start to get that directional identification, we're going to start to categorize what that directional identification means. Now, this is the broad picture stuff. This is the simple stuff that you see and that most of you, I'm sure, whether student or not, or practitioner or not, sorry, will approach things in a similar sort of manner. And the idea is we might go, well, within that directional identification, we will have a yin-yang quality and then also an idea of the environmental factor that's impacting this illness. So we identify that directional identification initially through that. And yin-yang quality is massive, obviously. The yin-yang quality, I mean, we're not even talking about pulses yet. We're not talking about complexion. We're not talking about channels yet. We're just trying to get an idea of core-based yin-yang pathology. Now, once we start talking about pulses, the Neijing, and particularly that Ling Shu, is so precise in those qualities when we start talking about yin and yang and seasonal pulses as well, which is obviously the transition of yin yang and environmental factors onto that pulse. So it's important to understand, but the initial sort of concept of the season, of the impact of those liu qi, the 6 qi, environmental qi onto the individual starts here. We then also start to get an understanding of precisely what channel complex is being involved. And when we talk about that component, it's primarily in that initial presentation and directional identification, we start to note those things in our heads of, again, we understanding yin-yang quality, that can give us also anatomical direction. And therefore, it can also start to give us an identification of what channel we're going to be working on. And initially, within that direction, what level we're going to be working on as well. So we start to get an understanding of internal and external and treatment criteria and examination criteria, because we're going to have to go, well, are we dealing with Jingmai? Are we dealing with a Zhangfu disorder? Are we dealing with Jingjin, so forth, as per the previous slide there? So we're going to start to get that understanding through there. We're also going to look at then on top of the yin-yang, but is the core seasonal patterning, different to environmental factors, because the environmental factors are qi that occurs naturally in nature that is now impacting us in a negative manner. You know, we talk about shun, what moves naturally with, and ni, what moves naturally or unnaturally against, right? And when we talk about that, then, okay, yes, cold in whole nature is normal, but if it's impacting the body in a negative manner, that's an environmental factor. The seasonal patterning comes to that understanding of what I mentioned before. If we're treating a season, or if we're treating in a season, or if the patient's body is stuck within a particular season, and you'll see this terminology within the Neijing of, for instance, like, you know, a summer disease manifesting in winter and those sorts of things. Our needling and our channel selection and point selection and things like that will start to alter once we identify the seasonal patterning. And that's going to also include the timing, which I'll just bring up in a second, but the timing of that, understanding what seasonal environment was the original, what seasonal component was the trigger, and what seasonal manifestation pathology is currently in. So all those aspects of that sort of come within seasonal patterning. We will ultimately, at that seasonal patterning stage, start to get an understanding of how the body should be breathing within that season, and then understanding of why it's not. And that will come down to core pulse qualities of both seasonal pathological pulses, which is sort of early Su Wen discussions, Su Wen 17, 18, that sort of thing. And then going into the deeper core yin-yang qualities as per Ling Shu 4, for if you're interested. So those sorts of ideas. Then we start to look at that tissue matrix and so forth that I've already discussed. All of these are not individual entities, the idea is that they are layered onto one another. And this is going to be also when we had that initial timing calculation. Okay, that came up a little bit late. I should have had that on the second click. But the idea was that it is the initial timing calculation of when did this disease come? What is the original trigger? What is the pathological changes? And then that can give us that directional identification. And you can create that directional identification very quickly as you go through this in clinic, because you'll start to figure out exactly where you need to start working on that patient. And it gets a little bit more complex from there, because then we have to ask ourselves, well, within that, we've got this base sort of foundational understanding of the seasonal patterning of that patient, the yin-yang quality of the disease, environmental factors involved, tissues that may be involved. But then how do we still create our core sort of diagnostic and, again, plan of action to create change within those tissues or within those channels and so forth? I hope I'm not going too fast. I'm going to slow down a little bit here. But this is where we go through what we consider the disease process and level identification. Now, one thing that we look at within the Neijing is that as we go through each level identification, it means our examination criteria will change, which means our intervention or our treatment criteria will also radically change. So our tools may change that we use. I like to use the term tools for needles because the Jodsen are a mixture of not just a filiform needle, not just the Haldsen, but they're a mixture of large shapes and sizes. So the tool that we'll use, and that will change. So it means that as the criteria changes from there, we have to then understand what we're treating. And then we have to time what we're treating within that to get a greater understanding of what comes first, what is the hierarchy of that treatment, as in what is going to be primary for that patient, what is an understanding of acute and chronic within that patient, and so forth. And this sort of structure can be applied to both acute, simple disorders, that require 1 or 2 sessions, and also chronic diseases that require long-standing treatment. So the first thing is for a very simple observation. Observation comes into all aspects of our treatments. We look at the complexion of the person. We look at, in Neijing acupuncture, the vessels. We look at blood vessels and actually see, look at the color. We look at where things not, the jie. We look at tissues. We look at the connective tissue of our jin. The scaffolding of the body and how that person sort of moves and understands from there. So from that, as we start to get an understanding of that, we start to go, okay, well, observation primarily is going to revolve around our lo bie or lo mai, our latitudinal circulatory components. Why does observation, why is the lo bie and lo mai, why does that require observational diagnosis? Because the Neijing told me so. And that's the primary answer to any question you have of why, David, are you doing this or why are you doing that? Because the Neijing told me so. And it's very clear that the law require observational diagnosis. Within Ling Shu chapter 10, it tells us straight away, but it also tells us one key aspect of that is that the lo are visible vessels, while the jing, mai, they're not visible. They are at a deeper level. So the more superficial aspects of the circulatory system require observational diagnosis. And we're going to be looking again for whether it's abundant or whether it's lacking in a certain way, nice and simple. And then we're going to use our treatment from that. Now, the Jing-Jin, our tendon pathway, is exactly the same. We're going to use observational diagnosis, as I mentioned before, to understand the mobility of a person, to understand how they're moving, to understand if they can move, to understand how structures are communicating with one another. This is all the good observational stuff. This is that readily apparent material as well. But of course, we don't want to just work here. That is just the first step. And then on top of that, we're going to have a diagnostic method called Renying Chen Ko. Renying Chen Ko is a pulse diagnostic method. Many of you who are in this talk have studied this with me in some form. And Renying Chen Ko is where we are assessing essentially unilateral circulation of the Jingmai, of that primary pathway movement. And we're doing it unilateral, as in we're assessing it left to right We're palpating the pulse at the neck. We're palpating the pulse at the wrist. We're assessing strength within those. We're assessing certain qualities within those. We're getting an understanding of whether it's going to be in the upper channels of the arms or the channels of the legs. And then we're going to go back to observational diagnosis, get an understanding of the tissue terrain, and then palpatory diagnosis within that as well. And so that aspect focuses on our Jingmai. And then between those two, they are going to be our channel and terrain needling strategies. And then from that, and what we're not talking about today is the needling techniques, individual needling techniques, but we are going to then start to get an understanding of what needling techniques we're going to use. What technique are we going to use for the lobier if there is knotting within it? Are we going to use an insertion technique? Are we going to use a bleeding technique? Are we going to use a massage technique? Are we going to need to use tendon techniques? Do we need to address them at all? We may not, and that's fine. We step away from that component. What about the focus on the Jingmai? Okay, there's an imbalance that sits through there. How are we going to address that? What ratio of needling? Because there is a ratio of needling that is required for those techniques. We're going to address those techniques from there. We're going to make sure that the Jingmai is communicated with appropriately. And this goes back to my idea of medicine being about communication, being about relaying the right message. And if we just saw this patient in this little pocket of disease process and level identification, and we just needled the Jingmai and we ignored the LOL in that instance, or we just completely missed it in our diagnostic criteria, then we're not doing that patient any favors. We are not treating everything we can, and we are not relaying the message that these individual entities of the circulatory system need to be addressed. Then we come over, palpation is always going to be key. It doesn't matter if it's through a pulse method, doesn't matter if it's through an observation method, you then need to palpate and get an understanding of what is occurring. Palpation is the primary diagnostic tool that you will use. You cannot be an acupuncturist without palpation skills. And there are varying levels and varying approaches and ideas of palpatory skills required to be an acupuncturist. Then we have this idea of Sambu Joho. Sambu Joho, and if for reference, if you want to look at Suwen chapter 20, which is called Sambu Joho, is about identifying different pulses and the strength of those pulses in various positional regions. So it's strength and positional circulatory assessment. When Renying Trenko is more about unilateral channel circulatory assessment, Sambu Joho is about that positional circulatory assessment. And these are different areas of wherever a primary representation of a moving vessel, a pulse, of your particular channel. So as an example, you have a pulsation on the kidney channel at the ankle, around Tai Chi sort of region, kidney 3. You have a pulse, well, you obviously have a pulse on the wrist at the lung, around Tai Yuan region, but you also have one around the heart region, around Shenmen. You have ones throughout your head into the scalp on the gallbladder channel. And you have different representations of pulsations through there. So even if you grabbed an anatomical text and you look at the different primary pulsation sites in the body, that is one way to start to apply Sanbu Joho, which is sort of the 3-level 9 indicators, pulse techniques. Understanding, is there strength of circulation in a particular area, and how can we then impact that? Now, that can impact our needling methodology within that, because majority of pulsations, particularly in the limbs for the channel systems, are Yuan source points. So already we get an understanding. What if something is lacking there? What if there is an abundancy? It can then be layered into many of the pulse qualities within the Neijing. That's a long-term pulse project that I've been working on for around 15 years. Is this idea of layering the different qualities discussed throughout the Neijing into each and every one of these pulse assessment methods. So from that, within the Sambu Joho, we are going to look at excess and deficiency, or abundancy and the lacking within the particular vessels of that. So we're still therefore working to an extent within the Jingmai. We're still working within where primary circulation occurs. In association with that, we're going to then look at the pulses, what's called Qiko. In the Neijing, Qiko, which is the pulse at the wrist, is also called Maiko or Chenko. So it's the pulsation that you would all most likely be using to some extent at the wrist region. Now, in the Neijing, it's quite straightforward. It's an anatomical representation. So I often just talk about it as sort of thoracic circulatory assessment, because it's assessing what's happening within each of the Zanjiao. It's assessing what's happening within, say, the throat, within the hips, the lower back, the legs as well. But primarily it's about what's happening in the center of your body and in relationship to the Zang organs. The structure of it is quite different to what you might have learned in standard sort of TCM school, and the structure of it can be also quite different in regards to standard aspects of even from the Neijing, which is a few hundred years later. So the pulse system in the Neijing is quite different. The concept of this, though, it still revolves around Zangfu and that seasonal identification. This is where also our sort of secondary timing comes into it, which will come up later, but that secondary timing of seasonal identification. Now we're getting an understanding of excess and deficiency, and this is what I call core needling. Core needling here is where we're going to be, supplementing a certain aspect of it can still be on a terrain, it can still be a tissue, it can still be on a channel, but we're doing it to immediately talk to what is happening in the inside of the body in that thoracic cavity. A good example of that is the use of the Hercy points. So there's a needling technique called Yuan I can't even talk, Yuan in the Lingshu chapter 7. And within that technique, the idea is that ultimately you're using the lower Hercy points to impact the Fu organs. So a good example, Zusanli for the stomach, or Xiangjushu, stomach 37 for the large intestine. Those sorts of things, Qiajushu for small intestine. So that direct impact of needling those things to get an understanding, or going to your 5 shu points maybe. And again, this approach within the Neijing is slightly different, but going to those 5 shu points or region, I often try not to use points, there's more regions of influence, going to those areas, needling them to impact or have a more direct discussion to what's happening inside for the organ component. I also put seasonal components and treatment through there, which is a different treatment strategy as well. So that's core needling. But within that core needling, we start to also get an understanding of, yes, palpation being, again, very important, absolutely vital for this, because it's how we actually communicate and how our initial assessment occurs with that pulse. But we start to get this idea that between core needling and channel terrain needling and these 4 different primary assessment methods, we constantly have a idea of refining and defining that intervention. So as that comes up, as we start to identify the level, which is what I call level-based diagnostics or level-based needling, they are mutually applied in order to create, again, that very clear, precise message between yourself and the patient through your messenger, which is that tool or needle. So when we start to look at that structure there, that right there is a very basic plan of action that within Neijing acupuncture, we would use in the clinic every single day. And like I said, it can look like a lot, but it doesn't necessarily need to be if you are sort of ticking the boxes off and saying, do they require this? Do they require that? Where is the disease lingering? And so forth. And that comes through questioning, that comes through your investigation and so forth, and refinement of that investigation. So that primary understanding and that structured plan of action within the Neijing. Excuse me. I hope it to an extent it makes sense. Like, you don't need to know what Renying Trenko is. You don't need to know what Sambu Joho is or how to apply it yet. But it gives you an idea of that we have very different, precise examination criteria that is required to identify where that disease is manifesting within inside the body. I hope that makes sense. And because I haven't done a webinar in a while, it's really weird not having someone so yes, that makes sense, or no, you're talking shit. It takes a bit of time to do that. So if I'm talking shit, that's fine. Send me an email, let me know. Continuing on from that, and I hope I didn't go too quickly from that, but also remember, we are recording this, you will get the recording. And like I said, if you're interested in learning how to apply these sort of structures or these sort of plan of actions and this diagnosis criteria, this is what I'm teaching next year. Um, you know, we start to look at what's missing within this as well. And you know, I'm being a bit of a smartass here, but it's a lot. Most of this is simplified, you know, for this short talk. There's a tremendous amount of layers within the Neijing, and we know this within Chinese medicine. I mean, if I was talking about a completely different text, you could have a very similar structured plan of action with different terms and be talking about the Shanghan Zabin Lun, and a tremendous amount would be missing from looking at that. But you could simplify it to get an understanding of how do we approach it. What is this? What is our initial plan of action? What is our initial strategy to create change? As we sort of go into this concept of looking at some different pathologies within the Ling Shu Jing, I wanted to bring up the absolute basis of pathological presentation. So as we're going through that examination criteria, as we're looking at those channels, as we're feeling those pulses, we've got to ask ourselves, what is that primary sort of pathological presentation on the vessel or on the tissue and so forth? And I tried to keep it as simple as possible, and I made two stupid little images here, but we have diseases of a contractive nature and you have diseases of an expansive nature. Diseases of a contractive nature, for instance, would be cold, would be B. And B as a B obstruction illness or impediment illness or whatever you want to call it, that is without a doubt the primary pathological presentation in the entire Neijing. It affects every tissue layer, it affects every organ. It is a combination of environmental factors, primarily cold, heat, damp, and wind. It is what we see in the Neijing as a sort of primary component, and it is that contractive element. And I put here yin realm and I put here yang realm. The yin and yang realm of and the way that yin and yang realm is used within the Neijing is quite varied. I mean, it can refer to specific anatomical regions, and in terms of superficial and in terms of the depth of a pathology, or even a physiological movement. It can also therefore be structure, and it can also be anatomical orientation in terms of front and back and internal, external, those sorts of things. But I'm using those terms, yin realm and yang realm, mainly to demonstrate that contractive and expansive nature of common pathology. So just so you understand, so if you come across these terms, I mean, say for instance, you're reading through Unqiu's Neijing, for as an example, yin realm, yang realm are used interchangeably in a few different areas, but they are often used for where disease may sort of manifest within the area in terms of that depth or structure orientation. But in terms of this idea of something is doing this and something is doing that, we're talking about how cold will go sort of deep and into those depths and cause contraction, cause contortion of vessels and of tissues, and impact that. And then we're talking about young, chaotic movement of qi and blood and other things. And it's not just young, chaotic movement doesn't necessarily just have to be heat, but it is primarily a faster movement that is occurring to substance. So we see that within Huang-based illnesses, Dianquang. So, you know, if you look at the Ling Shu, the Dianquang chapter, you see what happens when there is a chaotic movement in the yang realm. We see headaches, we see chest problems, we see skin problems, we see insanity and madness and all these other aspects. And we always ask a question for any pathological presentation, because you don't want to trip yourself up when looking at these pathological presentations. And you ask them, do they move with what is naturally so? As in, you can have cold in the body and heat in the body, and it could be a natural presentation of cold and heat. You have to ask, what is it actually doing to that person? What is the presentation? And you sort of reverse your way through, you reverse your way through all of this stuff. So the idea is always to ask, do they move in a normal manner? Do they move naturally? Do they move in an abnormal manner? And then you go into aspects of understanding diseases that move in a normal manner. That's the other question. But also, what if that disease is moving in an abnormal manner? What if that disease is moving through pathways which are abnormal? What if that disease is becoming obstructed in areas that are abnormal? And what happens if there is a reversal of that movement? And it could still be that you have a xie lingering in the body, you have cold lingering in the body, but then all of a sudden that cold moves in a unique and obscure manner in a reversal, such as cold within the kidney channel, causing a reversal, causing problems of tension in the lower back, causing problems of weakness in the lower yin. And, that changes, and it will change your strategy. So diseases of contractive nature and expansive nature have that. And then you have diseases outside of that as well, or semi-related to some of these, like, for instance, Wei disease, kind of limpness or where there's a lacking and a lack of movement, paralysis, which can come also from B-based obstruction illness, or also from aggressive movements of yang and heat. You kind of have ones which mix and match between the two. And then on top of that, you have cold diseases which turn to heat, and controversially, sometimes heat diseases which turn to cold, though that is a controversial subject for a different talk. But otherwise, cold turns to heat quite often, and that creating rather complex disorders and complex diseases. So primary pathological sort of representation goes back to that core yin-yang environmental directional identification in our structured plan of action. And that's kind of where we start to get an understanding of this concept I'm working on, which is processional pathological metamorphosis, which is just a fancy way of saying disease moves and disease changes. But it is a defining feature. It's not a defining feature of just Neijing disease tracking and analysis. It's a defining feature of medicine. It's a defining feature of functional medicine, of any sort of specialty within the medicine, of an understanding, and particularly if you look at Chinese medicine, and it is represented very clearly in, for instance, again, the Shanghai Mun, in a different way, in a different model, but it is represented. But in the Neijing, it is one of the primary ways of just how we discuss how disease moves, where disease gets stuck. So just to read through this, it is the understanding pathological origin and the ultimate destination in order to appropriately infiltrate where disease resides or where pathology resides. Because after all of that examination criteria, after all that understanding, we still need to get a core understanding of where the disease is, what that disease is, where and what, and then where is it going to move next? Is it going to move next? Of course, we have to ask ourselves, but if it does, where is it going to move next? How is it going to transform? How's it going to transport, and go from there? So we're looking at this, how disease manifests, what factors contribute to its transposition, and the direction in which that change not only takes place, but travels to. And that is how we are going to create efficacy within our clinical practice. So PPM, processional pathological metamorphosis, can occur along differing pathways or passageways. And this is a really key thing. We often we have tunnel vision sometimes in clinic when we're looking at particular diseases or presentations that the patient has been telling us. Oh, it's a very important thing. Don't listen to your patients. Just touch them and look at them. But when we get that tunnel vision, and we sometimes get either lost in regards to exactly what we're trying to treat, or we end up focusing on the wrong thing. And it's because sometimes we have multiple pathological presentations at the same time. So basically we get differing passageways, differing destinations, but they occur simultaneously. And often it's a combination of chronic, complicated disease that present themselves, sometimes with acute manifestations. And I give an example here of deep-set bone-based beat obstruction. Very common. We see that very commonly in cancers. We see that very commonly in degenerative disorders. We see that very commonly in aging disorders. And that bone based beat contraction may be obstruction, may be occurring in very particular regions of the body, say, for instance, spinal cord. It may be occurring or within the pelvic region, pelvic floor, and affecting what also we may see as tendon-based B obstruction as well. Now, they're two absolutely different levels that may have very similar pathological presentations in terms of, one, what the patient feels, two, what you initially might be palpating and how that patient moves, but they may or may not be related within that individual. Now, in the instance that I just gave you, yes, they probably would be related if we're talking about a bone-based B contraction that is affecting the pelvis, and also they happen to have pelvic floor contractions and contortions. But if in general you might have something in a different area, you need to have that understanding of identifying whether it is that part of the same pathological process or not. What I'm going to give you next are two very, in my opinion, straightforward examples of this processional pathological metamorphosis. And they are related to two particular techniques, which you probably will be familiar with. But I'm using them as examples, not as concrete representations of the technique as much, more as concrete representations of this processional idea. So bear with me as we go through this. So the first one here is what I call the linear path of PPM, which is where a disease is manifesting in the physical form at an external level and slowly making its way until it affects the zang and fu. Very straightforward, very simple. In Neijing acupuncture, you will see this in relation to Jusa technique. For those of you who studied with the Guanzhen, I've talked about this before. But taking away the technique for a second, we're just looking at how disease sort of moves through, how that pathogen may reside at each of the individual levels that it moves through, and so forth. So this is called the linear path. It ultimately revolves around the fact that that disease is entering into the jingmai. So even though it affects other areas, it is entering into the jingmai, which is now giving it a direct access to the zangfu. It's like if you're dealing with, if you say you live in Beijing, and if you know the structure of Beijing, you've got like Forbidden City, and then it goes down a few streets, and you've got Tianjin, you've got the Temple of Heaven, and you've got streets on the side, and you've got the ring roads that go around. And if you're not sure of Beijing structure, then look it up. But it doesn't matter. Any city structure will have a similar thing. Primary pathways or primary conduits or primary main roads that run through a city, and then you've got all the little alleyways around it. In this instance, it's still as if those bandits that are coming to attack this city are at the external wall, and they're going to slowly start to make their way in. Now, each time that they make their way in, so at the moment, if they're sitting at the external wall, they're banging on that wall, they're trying to knock down, I don't know, some doors. I don't know. I get too deep and it will be like I'm reiterating an episode of Game of Thrones or something, but they're trying to do that from there. So the external component there, now each time they're at a level, they are residing there. They set up camp for a bit. Now, sometimes they linger, sometimes part of them linger, sometimes part of them move on. That's where we need to start to try to identify what's happening here. You know, and if we use we'll talk about cold maybe primarily, but even if you just have this image of a bunch of bandits trying to infiltrate and attack a city, you get this idea. They sit at the external component, they move through, they start to infiltrate the more superficial portions of your city wall. And in this case, we talk about hair and skin. Then they go into the superficial and smaller laneways. You know, they're like in the favelas, you know, they're in that sort of messy component of it, sitting out there, causing a little bit of havoc, but it's not, they haven't lodged themselves there for a long time, or primarily they're not causing a huge amount of chaos, but they're there and it's identifiable they're there. Within the clinic, you would see them in the sunmai as, for instance, those vessels start to become enlarged, small blood vessels, sunmai being the smaller blood vessels, become enlarged. Let's say like the xiaomai, the xiaolo, also become enlarged. The vessels might be changed color, and there might be obstruction within those blood vessels. And then they start to go to the lomai, and they sit at the lomai for a bit. Now, these are the larger alleyways and things that come off the main street, the main road, the highway, or whatever you want to call it. And they linger there for a while. But then they make a decision not to go in the back streets, and they're going to storm the castle straight on, castle being Zhangmenfu. And now they're in that main road. That is where our understanding of the damage that is going to occur, it really leads us to our clinical strategy of treating these individuals. Now, if we can treat them at the wall and get rid of them early, fantastic. Now, most times our body will actually do that anyway. That's, standard defense. If we can infiltrate them and intercept them when that pathogen is sitting in the sunmai and lomai, this is early stage stuff that we might be able to do. But once we see it and identify it within the jingmai, which we do through our various examination criteria, we have to use a different strategy of making sure that we are actually going to infiltrate a needle in the jingmai to make sure that they do not eventually get to the zangfu. If they get to the zangfu, same thing. If they linger in the zangfu too long, most likely a patient's going to die, or they're going to become extremely ill, or treatment becomes very difficult. Now, because there is this sort of path of destruction that goes along, it makes it a little bit difficult, but it is a direct path. You kind of know, okay, where they came from and where they're heading to, especially once that identifying component of the jingmai, of the primary pathway, is seen. So the path, and again, it doesn't really matter about understanding this initially. The idea is I'm just trying to give you an example of how a disease may move through different structures. They're going from the external component in a linear path until it reaches the zangfu. That is one, and it's quite common. There are different strategies involved. The reason I says jutsu there and jutsu plus is just one of the strategies involved in terms of a unique sort of cross-needling method based on the pulse. At each section that pathogen resides at, while it lingers there and while it starts to shift, so the pathogen traveling from one level to another at each interval, that pathogen will shift and alter in presentation. So now all of a sudden we have a disease that started in one way is now looking like something else. And it is starting to leave traces as it starts to look like something else as it goes through. Okay, so as that disease moves, it changes. As it lodges, it changes, and there will be key again, identifying characteristics of that change. We need to get in there and we need to intercept it as fast as we possibly can. That is the core of acupuncture. Now, majority in our practice, we don't get to see our patients fast enough, so often our interception does sort of linger within those last three stages of lomai, jingmai, and zangfu. And it is the next one, the next level, here we are, where what happens when it does get stuck in that lull and it gets a little bit complex. And this is what we call the overflow path. And this is where it goes from the hair and skin. Now, the fact that it doesn't have skin or the physical form there doesn't really matter. You could also start with that, but it starts with hair and skin in the text and eventually reaches the four extremities. Excuse me while I take a sip of water. And this is focused on the lull network. See, the difficulty is something is walking down the primary. If you've got a bunch of bandits walking down the primary road in that city, you can identify them, you can see them, and you can see where they're going. Imagine you're standing on a tower and you're looking down and you see that chaos walking down there. And yeah, they're causing a little bit of trouble in the side streets, a little bit, but they haven't spread into the side streets. Now, in this case, excuse my coughing, in this case, they're heading straight for those side streets. And in doing so, they are causing havoc in those side streets, and they do not enter the jing. They do not enter that primary circulatory pathway. They are all in the secondary circulatory movements. And in doing so, you lose sight of them. You lose sight of what they're doing. You lose sight of what the lodgement is happening. And the diseases now, or the chaos that they're inflicting upon things, is now very chaotic, very confusing, and sometimes not even matching. Excuse me, I'm just going to have a cough. So, got to stop smoking. No, I'm joking. Okay, so the disease enters the hair and skin. Xie enters in through there. The xie. It doesn't matter what the xie is at this stage. It doesn't, it doesn't matter for this example. If you want to call it cold, call it cold. It then goes, so it's going in this still linear path, but as it's doing it, it's moving in a unique passageway, hence why it's called overflow path. It goes into the Sunlo. Now, we had before Sunmai, Sunlo, essentially the same idea. We're talking about superficial or peripheral network of our circulatory system. It lodges in there as well. From here, it's starting to think about going to the Lo. It's starting to think about going to the Jing. And in this case, it cannot enter the Jing. For whatever reason, it becomes lodged and stuck. And we see here the Dalo, the larger Lo circulatory vessels. And this is where you will also see actual physical changes in the larger vessels and observable changes within the Lo Bie, the Lo separation points. We call them Lo points in modern acupuncture, right? They're the Lo separations. We're looking at the vessel. So you're looking at the vessel of Neiguan. You're looking at the vessel of Ligor, or whatever, Lo region you're looking at. You're looking at that vessel. And you're starting to see an obscure sort of change in that vessel. It might become dark and abundant. Now, the abundancy is the more common representation because cold is the more common representation. But it can also be a lacking, as in they've just destroyed it. They've taken everything. They've gutted the area. It's that kind of thing. Think of them just completely destroying. Yeah, sometimes they set them on fire too, and it's hot. But, they've just gutted it. And now what we have is what's called shear overflow. It is now spread through that circulatory system. That earlier image I had of the river system that spreads like this, that was the Ganges. It's the Delta. I can't remember. But that primary one, it's now spread in all those little circulatory components. And now the strange diseases manifest. A good example of strange disease in this, and one that's kind of been taken out of context in modern day, is the use of Fenglong for throat. It's what I need now, right? For phlegm in the throat. Fenglong. Stomach 40. And within that, Fenglong is often used for that obstruction. But if you look at the signs and symptoms of within the Lo, Fenglong, when there is elements of a change occurring with that, the vessel itself becomes obstructed, that is going to cause this obscure, far-reaching altercation elsewhere within that pathway of the Lo. And in that case, we're going to get an obscure sort of obstruction within the throat, phlegm within the throat, and an inability maybe to talk appropriately, throat-based obstructions, things like that. And it's going to all happen up high in here. Now, that might be an obscure thing that may also not be initially and directly a correlation to stomach channel, because it's not in the Jing, so it doesn't matter, but it's the Lo. So we start to get these understandings of these obscurities that happen through there. Some of them are straightforward. The Leche obstruction, for instance, might just be burning in the palm. But again, why that burning is occurring is because at the moment, that Qieqi, that, again, if we stick with the idea of cold obstruction, that Qieqi is stuck and it's causing a knotting within that vessel. It's causing that vessel to change. And now all that peripheral circulation is now becoming diseased. And that is what we call shear overflow. We get strange diseases. Now, uniquely, and this is where Sue in chapter 62 and 63 talk about the concept of mutsu or misleading needling, which is why I have it there as an example. But this idea is that now it's in the Lo, we now get obscure movements of that disease, in that we may have a change within the observable vessel on one side, and yet the presentation of the disease and what the patient is telling us is on the other side. And this is this, as an example, again, is one of the primary underlying mechanisms of cross needling that you would see. I don't know if that's how other people apply it. I don't really care. But that is one way, is that now we start to get these strange diseases. From left to right, they transfer. And it's observable within the Lo pathology of that. And we're going to treat where that Lo pathology is manifesting, even though the illness may be on the opposite side, even though the manifestation of the illness may be on the opposite side, the identifiable characteristic within our examination criteria is on the other side. So we're going to treat that one. Now, from there, it goes into the four extremities, what they call mutual defense. Now it's just gone chaotic. Now everything around that primary, road into that city is burning. But you might, the Zhang and the Fu are kind of sitting there. They're kind of okay. They're kind of safe. But mind you, everything around them is being destroyed. And then we get what we call itinerant xie, as in that itinerant xie that is constantly moving, constantly. And now it's hard to catch because they've taken over your city, essentially. You may be sitting there up in your little castle in your tower, but the rest of what you have around you is getting destroyed. And we see this also within very complex disorders, again, looking at cancer treatments, looking at how LOL pathology is related to changes within hidden and deep tissues as well, where the LOL, because of that overflow and that strange disease, it has spread like wildfire around there. And then basically, again, it is unable to enter the Jing. It is not able to enter the Jing. That's one thing that you've kept. The Jing remain there, but it doesn't matter. It's going to eventually destroy everything around it. And once you destroy everything around it, the Jing themselves will fail. The primary things will fail. The Zhang and Fu will fail. And then the death will result. But it's a unique movement of illness. Now, again, the same as with our linear path, treatment can be applied at any of the presenting levels that represent here, and we can intercept it. And if we are proficient and clinically efficacious in our Neijing acupuncture and our techniques, hopefully we can intercept this before it lodges deeper, before it turns into that sort of wildfire movement, and we can create the appropriate change and the appropriate technique, and therefore health. Okay, so that's kind of the idea of those two structures within there. Now, they are quite, and I mean, when you look at them and study them for a while, you go, oh yeah, it makes sense, but they are quite complex ideas. And they become really complex in clinic when you're trying to identify, especially when you already have diseases that may be immediately apparent in the physical form, in the hair, skin, the Sun Lo and the Da Lo there. But you're missing that the disease maybe has already transferred left and right, or that the Xie Qi is actually an itinerant Xie Qi and it's moving in a radical way, or that the Jing have been affected, and you start to miss these things. And that is where this concept becomes very difficult in clinic and becomes more troublesome. Now, as I mentioned, that this idea of linear path, overflow path are just two examples of processional pathological metamorphosis. You can apply a similar understanding, and you can look at how diseases shift and move through the 5 phases. You can look at how they move through the 6 conformations. You can look at them through the yin and yang realm interactions, and you can look at them through that earlier compass of Jinglo components. But that is, in my opinion, one of the best representations of this idea of understanding how pathology shifts, lodges, and causes severe diseases in the Neijing. And from that perspective is one of the greatest principles that we can learn in applying Neijing acupuncture. And it's something I hope within the course and within my future teachings that I can appropriately teach people to identify, to improve their clinical practice. And I often do this through also teaching some of the needling techniques, but it's also a different type of course I'm starting to develop within the Neijing to teach this idea. I think I've just rambled on for long enough, right? That's probably enough, because that is the last slide. So it's definitely enough. I really hope that what I've just talked about made some sense. I also hope it didn't make sense and it's enough to entice you to come and learn a little bit more. I also hope that if you have questions, by all means, reach out to me. It's worthwhile following the INR on the Instagram things. I post a lot of tidbits about the Neijing if you're interested in that. But by all means, come along and discuss things with me, and come and learn some of this stuff. It's pretty cool. And by all means, if you are interested in the program, reach out to me, but also ICOM, particularly to register for it. We will have more details and ideas, and we'll have a month-by-month breakdown of it, dates for face-to-face learning, which will be focused on London. If there's enough students, for instance, in Australia, I'll do workshops here in Australia for the Sydney students. I know there will be students from Canada and other parts of North America, or America, like in North America in general, that will be joining, who will figure out what to do with them, or they'll just not do the practical stuff. I don't know. But we'll figure that out. But if you have questions specifically about material, anything like that, by all means, I'm happy to be contacted by anyone. And, always give me about a week to reply. If I don't reply, then hassle me. And thank you very much. I really appreciate it. Thank you very much to ICOM. I hope that talk was of interest to people. Thank you. I don't know what's happening. Maybe someone, Tom or Josh, will say some things.
Yeah, look, David, on behalf of everybody, thank you very much. Super inspiring. And I love this idea of learning a kind of structured way of thinking about things based on these original texts, so that you intervene in the right place at the right time, but with this kind of adeptness and flexibility to do what's right at the right time. That's
what it's about.
Yeah, that's definitely the orientation that we're trying to develop at ICOM as well. So, I love that we're
Good.
collaborating.
Yeah, I think we'll be able to develop something quite special there.
Yeah. So yeah, on behalf of everybody, thank you so much. I thought that was utterly brilliant and really inspiring.
Wonderful. Thank you very much, Tom.
Likewise, if you want to join the course, and it's going to start in summer next year, just check the ICOM website and sign up. And it would be really nice to travel as a kind of community through this inquiry.
I was going to say, it's one thing I hope we can develop with that is a proper community of study with it as well. I mean, like I said, I'm also here and to learn off everyone else, and as they approach the text and start to get ideas. With some wonderful people who already do work with the text really well. I know Deborah's there, Tyler, Pernilla. You're working with that text. You're trying to apply and use some of these methods already in clinic, and you have been for many years, most likely. So I think that community and the discussion is really, really a vital part of it.
I mean, I think that there's so many questions that come up that would just take us all day to ask. So that hopefully that will be part of the journey that we go through, is that we can ask for clarification.
Yeah. Well, and if you're unsure of things as more information about the course comes out, just reach out to me. I'm happy to answer questions. Happy to be contacted. Not by phone, just email. I don't want to talk to anyone. Yeah.
Well, yeah, David, get back to your baby, your dog, your wife. And
I'm gonna go sleep now.
Yeah, thanks very much for taking the time. I really appreciate
Thanks,
that.
man. Yeah, wonderful. All right, thank you, everyone.
Guys, have a great day.
Catch you soon. See you.